all, how are you all doing? Hope everyone is safe. I know the pandemic is very bad, but we are all going to live with it. Take all the precautions to avoid the infection and stay safe. Hey all, this is Dr. Lavanya, Obstetrician and Gynecologist from Puducherry. I know I'm sorry for delay in uploading a YouTube video. It's been almost 3 weeks that I haven't uploaded a video. But yeah, today I'm here with you all discussing an important topic, preconceptional planning. So what is preconceptional planning? Hey there, if you or your sister or your cousin or your friend is planning pregnancy or is newly married and is about to plan pregnancy, you are at the right place because we are going to demystify everything about preconceptional planning. So what is preconceptional planning? 43% of the women, 43% of the pregnancies are unplanned pregnancies, and more than 60% of the women in India are anemic. That means most of the women are anemic while they are conceiving. That means it is going to have an adverse effect both on her and her fetus. So avoid all these things by having a proper preconceptional plan. So according to CDC, preconceptional health is the health of the men and women during their reproductive years. So I'll tell you in 10 simple steps how will you approach towards your pregnancy to have a healthy mother and a healthy baby. The first and foremost, the first step, ask yourself, are you ready? Are you ready physically? Are you ready emotionally? Are you ready financially in order to have a baby and to be a parent and take care of a new child? The second, as soon as you answered yourself this question and you're sure of having a baby, discuss this with your partner about how to share the responsibilities and about how to take care of the newborn, how to allot the times, how prepared are you financially of inviting a new member into the family. So once both of you are sure that you're going to have a child, the third thing is inculcate lifestyle modifications. By lifestyle modifications, I mean diet and exercise. Have fresh, home-cooked food, organic food preferably, whether it's vegetarian or non-vegetarian. Avoid outside food and junk. And introduce yourself to exercise regimen. It could be simple walking, or it could be jogging, or it could be gymming, or anything. Introduce yourself to a fitness regime and allot at least 30 minutes of your time in your daily routine. And the fourth thing, if you have been a social drinker or a smoker or you are an addict to coffee, because if you are work, please stop all these things. Stop smoking, stop having alcohol, whether it's social drinking, occasional drinking, whatever. Completely stop having alcohol and quit coffee. If you are not able to quit, limit the portions of coffee which you have. Not more than 1 cup of coffee each day. So these are the changes which are really very important, because if you are consuming alcohol, it can have an impact on the fetus. It can result in something called as the fetal alcohol syndrome, which I'll discuss in detail in some other video. So this fetal alcohol syndrome is going to affect the growth of the baby and the well-being of the baby. So better avoid alcohol and smoking. And as you have inculcated lifestyle modification, stop smoking, alcohol and coffee. Now it's time to consult the gynecologist. She will examine you and run a battery of tests where she assesses your physical well-being and assesses your blood counts and your blood sugars, measures your blood pressure and checks for all the underlying health issues. And if she finds you are anemic, she'll start with supplementation of iron or folic acid or vitamin B12, depending upon what is the type of anemia you have. And if the blood sugars are elevated, it's good to have a preconceptional health checkup with your gynecologist so that you are healthy while you're pregnant. And the next important thing is, if you are a known diabetic, or if you are a known hypertensive, or if you are on treatment for any other health issues, it is better to discuss your plans of pregnancy with your general physician, because the disease per se can have an adverse effect on the pregnancy and the growing fetus, and the medications which you are using in order to treat this disease can cross the placenta and reach the fetus can have adverse effect on the fetus. So that is the next important thing. And the next thing is folic acid supplementation. When you consult your gynecologist, she'll start you with folic acid, 400 micrograms of folic acid. 400 micrograms of folic acid has to be started at least 3 months prior to conception, because folic acid is an important micronutrient which is involved in the synthesis of genetic material, preventing anemia in the mother and also preventing the neurological effects. So it is beneficial to both the fetus and the mother. And the next important thing is about your mental well-being. So do not stress out no matter what. No matter what, nothing can affect you. You are going to have an optimistic approach to your life, to your pregnancy and to the coming baby. So practice meditation. I'll link in some apps which are absolutely free, which help you in practicing meditation, and also some apps which are free to get you into the routine of exercising. So please check the description box. I'll be linking the different apps which are useful for you to follow these fitness regimes and meditation and other things. And the next important thing, the most important of course, is because of the COVID pandemic, life has become really unpredictable, but yet we are going to live with this. So take all the precautions to avoid infection, and please check the other videos which I have done about how to deal with pregnancy during COVID times and how to avoid infection, and if God forbid if you are infected, how to deal with pregnancy once you are infected.
And finally, the genetic screening for any diseases which you or your partner could be a carrier, to assess how much the fetus will be at risk if you both are going to have a kid. So this is a topic of great discussion which I'll do a separate video. That is the final one.
So that's it guys, that's about the preconception planning. Hope this was useful. Please share the video with all the couples who are planning pregnancy. Your friends, your cousins, your sisters. Share with all of them. It will really benefit all of them. Please like the video, share and subscribe to the channel. This is Dr. Lavanya. Thank you.